Hello and welcome. My name is Dr. Samantha Briguglio. My patients call me Dr. B, and I'm a naturopathic doctor that specializes in hormone health and fertility care. Today I'm going to share all about why I decided to get into naturopathic medicine. I'll share a little bit of my story and my past, and then later on I'm going to talk about why I decided to specialize in hormone health and fertility care. So, my story. When I was a child, I was actually pretty sick. When I say a child, I'm talking around age 2. I was on oxygen breathing treatments at least 2 to 3 times a day and many medications. They knew there was something going on with the respiratory system, but they weren't quite sure what truly was the root cause of these issues. My mom kind of decided enough was enough when they wanted to go in and get a biopsy of my esophageal tissue to see, what could be going on. She was like, she's 2 years old. She's not ready for that. So long story short, my mom then found naturopathic medicine and it changed my life. It had the most profound impact on me as a person, and I felt like I went from a sick kid to an athlete and someone who enjoyed their life to the fullest and wasn't worried about going into asthma attack. In fact, today I actually don't even have issues with asthma anymore. Long story short, the healing journey started when I was a kid, and I have lived those healthy diet and lifestyle habits ever since. Fast forward, I eventually went to Naturopathic medical school, which, for those of you who know, is a 4-year medical program. This has to take place after your bachelor's degree. So I had 4 years in exercise science with a minor in chemistry, and then 4 years in the naturopathic medical program. Within this program, we have all of the basic sciences, and then we go into all of the diagnostic classes, including, cardiology, neuro, and so on. In addition to pharmacology, we also learn about herbals, we learn about physical medicine, we learn about nutrition, we take many years of nutrition. Basically, we learn a lot of different things and a lot of different modalities, which I say expand our toolkit. I say that, but in reality, that was something that our teachers actually said, and I just think it makes a lot of sense, so here we are. Naturopathic medical school was difficult. I'm not even gonna lie, I'm not even gonna sugarcoat it, but it was definitely worth it for what I can do today to help people heal. Okay, so now you know my story about how I got into naturopathic medicine, but how did I get into hormone health and fertility care? How did I decide what I specialize in? So originally I wanted to work in pediatrics. I loved it. I was a sick kid. I wanted to help sick kids. And long story short, COVID kind of threw things for a loop for me. I ended up kind of stepping away from the pediatric world because you need so many in-person hours. I was not able to make them up in that time during, this season of life, which ended up being a really good blessing for me. I love kids. I love working with kids, but it ended up not being the path for me. And I got launched into the world of hormone health, and I dove in head first, loved it. I thought it was really amazing and really powerful. Following the hormone health journey, I then found my current mentor. She actually is Hello Fertility on Instagram. Love her. Will always give her a shout out. Dr. Jacqueline. And I found her fertility class and I was like, ooh, this sounds super interesting. Let me do it. I fell in love. So after that, I actually learned she had a mentorship. So I made plans after I graduated to do that mentorship. It was a year-long mentorship. We had grand rounds. We went over cases together. She had so many extra credit hours when it came to learning about natural medicine and fertility. I gotta say, most naturopaths that come out of naturopathic medical school probably shouldn't say they specialize in fertility unless they do something like this, because honestly, we learn a lot, but learning how to use our medicine specifically towards fertility, game changer. So after that, I was like, I'm good at this and I love this, and it became a major passion. And as I'm on this journey, I find out that my grandmother actually struggled with fertility for about 10 years. And then my mother also had a pretty traumatic loss. So at the end of the day, I feel like I was always called to this, and it becomes so rewarding to help people on this journey. It's emotional. I get emotional. Who knows, during some of these videos, you might see me get emotional because my aim is to make these raw, make these fun, make these very real, because at the end of the day, like, fertility is messy. Like, the infertility world is hard. It's a roller coaster ride, and I want to be on this journey with you to support you, to make you feel heard, make you feel seen, and to make you feel understood, or at least as much as I can. So my goal through these videos, you might see me be silly sometimes, you might see me get a little emotional sometimes, but my goal is to create a safe space for those going through a hard time, as well as an educational space. I just want to say hi and welcome to my channel. In the next video, I'm going to be talking all about my thoughts on fertility care, conventional versus natural, conventional used with natural medicine. I'm so excited to share my thoughts on this. If you do want to dive into natural fertility and hormone health care, please don't hesitate to reach out and click my link in the bio. It will show you my ebooks, my masterclasses, even how to work with me one-on-one. I do offer consultation calls, so again, please don't hesitate to click on that link. It will also be attached at the end of this video. I hope you have a beautiful rest of your day, and I look forward to seeing you soon.